During the health reform debate, many Minnesotans became well informed about the most controversial aspects of the law, while hearing little about the basics of the legislation. Professor Lynn Blewett explains that the law does have a focus.
It's reducing the number of uninsured by about 20 million people over time. So the real focus is on low-income uninsured, uninsured children. There's provisions for people age 55 to 64 who have trouble getting access to coverage.
One concern many Minnesotans have is how health reform will be paid for. As Professor Blewett explains, much of it is built on cost savings as a result of the legislation.
We do think there's going to be a reduction in uncompensated care. So that should translate into lower premiums and lower out-of-pocket costs. Some of it's related to, right now there's grants that go to hospitals that serve a disproportionate share for low-income population. That's going to be reduced. There are some provisions related to hospitals in terms of the contribution from Medicare and Medicaid.
It's also important to remember that since the law takes effect over several years, there is room for future changes.
Implementation for the major provisions start in 2014, and a lot of the projections in terms of the costs and the coverage go out from 2014 to 2019. So from that's almost 10 years from now. And so there is really an opportunity to see some changes to make it fit with what's needed, what kind of financing we have, and there'll be opportunities to work around the edges.
Many feel that the Affordable Care Act does a lot to improve access, but that its cost-saving measures don't go far enough to address the fundamental inefficiencies in our system. For Minnesota 2020, I'm Aaron Sinner.